In this video, we discuss oncolytic viruses. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Viruses can be used as a way to transmit DNA into a cancer cell. Once inside the cell, the DNA can replicate and destroy it. Additionally, viruses can be used to evoke an immune response in the patient. The earliest oncolytic viral therapeutic to make its way through clinical trials was Advexin, manufactured by Introgen in the early 2000s. Advexin worked by administering large doses of the tumor suppressor gene p53 to the patient. p53 is crucially important for ensuring genomic stability and is the most mutated gene in all of cancer. Once inside the patient, the p53 copies trigger cancer apoptosis without harming normal cells. Advexin had exclusively positive clinical trials with low side effects, including a phase 3 trial that showed Advexin increased median survival from 2.7 months to 7.2 months in refractory head and neck cancer patients who had p53 mutations. Instead of this leading to FDA approval for Advexin, the FDA stated that Introgen's application for a biologics license was not sufficiently complete. On Wall Street, this was taken as the FDA's rejection of Advexin, and Introgen was soon bankrupt. As the FDA rejected Advexin in 2003, the CFDA, Chinese Food and Drug Administration, approved the use of gendesine, another p53 editing biologic that was very similar to Advexin. Between 2004 and 2013, gendesine was used on 30,000 patients, 10% of whom resided in a country outside of China. Gendesine has led to complete response rates of 30 to 40% and partial response rates of 50 to 60% with very low side effects. Although approved for head and neck cancer, it is routinely used in China against a variety of cancer types. It has also been used in conjunction with chemotherapy, radiation, and thermotherapy, and tested in over 30 clinical trials. Although gembesine is typically administered via intratumoral injection, it can also be administered via arterial infusion, so piercing the tumor itself is not necessary. Gendesine is not registered in any trials on clinicaltrials.gov, and it is not clinically approved outside of China. A single dose of gendesine costs $400 and is given once a week over the course of 8 weeks. It would be over a decade until the FDA would grant approval to an oncolytic virus in 2015, t-vec. T-vec is a genetically engineered herpes virus that replicates in cancerous tissue but not in healthy tissue. It also has a gene inserted to stimulate production of GM-CSF, a key immune response signaling molecule. In the phase 3 trial that led to t-vec's FDA approval, t-vec led to a median overall survival of 23.3 months in stage 3 and 4 melanoma, compared to 18.9 months for GM-CS as a monoagent, which is also a clinically approved therapeutic. t-vec also had a 31.5% overall response rate compared to 6.4% for GM-CSF. Real-world analyses have indicated that t-vec may actually outperform the data from that phase 3 trial. For instance, one single center study out of Europe with 26 stage 3 and 4 melanoma patients achieved a 88.5% response rate. Another multicenter study with 88 stage 3 and 4 melanoma patients achieved a 63.7% overall response rate. As such, there is a significant chance t-vec is being underutilized. Many investigational oncolytic viruses are currently making their ways through clinical trials. One with particular promise is PVS-ERIPO, which is derived from the polio vaccine. It has shown successes in melanoma and recurrent glioblastoma. Clinical trials are currently underway for PVS-ERIPO in a variety of solid tumors. For more information about oncolytic viruses, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.